Hi, my name is Ektaa. I work at a legal NGO called Section 27 in South Africa. South Africa today is one of the most unequal societies in the world. At Section 27, we use the law, advocacy, and community mobilization to demand access to healthcare and basic education. During the 1980s and 90s, South Africa had the highest rates of HIV infection in the world, with over 600 deaths occurring every day. People living with HIV took ownership of the struggle and formed civil society organizations, the Treatment Action Campaign and the AIDS Law Project, to demand life-saving ARV treatment. They also shook the global access to medicines movement by tackling multinational pharmaceutical companies by demanding that governments be allowed to import generic ARV medication, which was cheaper and more accessible to save people living with HIV. They also successfully litigated against the South African government to demand the provision of prevention of mother-to-child transmission of HIV ARVs. Section 27 has since the AIDS Law Project became Section 27, which continues to do health treatment literacy and facility monitoring. This informs policy processes to make both targeted and systemic interventions to advocate for health systems strengthening. Our work on HIV expanded to all aspects of sexual and reproductive health rights. This includes access to contraceptives and advocating for access to abortion services within the public sector. We also do work around sexual violence in schools. Another part of our work in health is access to mental health care, which is an under-resourced aspect of our healthcare system. We recently represented the families of mental health care users who were removed from mental health facilities and transferred to unlicensed NGOs where they were neglected and many of them died. We successfully represented their families and in an arbitration award received compensation for the families and a structural order for the government to improve the mental health care system. The other aspect of our work is access to basic education. Through litigation, we have advocated for components of the components of the right to education, including access to sanitation, infrastructure, and textbooks. Although on paper we have access to an inclusive education system, in reality, learners with disabilities are excluded from the education system entirely. Through advocacy and litigation, we are trying to advocate for an education system which includes learners with disabilities, particularly relating to scholar transport, to cater to the needs of learners with disabilities, and through adequate care of hostel facilities where learners with disabilities are often neglected and abused. We also use the media as a tool to foster public debate around issues relating to social justice. We have a publication called Spotlight, which has uncovered widespread corruption within the health sector. It is also used as a powerful tool to hold both government and private actors to account. We have made concrete policy changes and made many inroads in the struggle for social justice. However, we welcome support as we have a long way to go. Thank you.